So let's use financial. Let's say, for instance, you're getting to an age where your adult child is coming to help you with managing your checkbook and your finances, maybe your savings and investments. That can be very anxiety causing for a number of reasons. One, it represents a loss of independence, but it also represents, if even the slightest thing is imperfect in a checkbook, can cause that elderly person to feel anxious, not because they're wanting to blame their adult child for making an error, like if they fail to enter a number in the check register, or to whom a check was written, or for what purpose, but it's just a representation of not being perfect, because anxious people tend to set the bar really high around perfectionism, and unwittingly, and then that's very difficult for not only the anxious person, but for anybody in relationship to them, because perfectionism is a moving target and it's very subjective. So what's perfect in your standards may not be perfect in the next person's. And what's perfect for you one day may not seem like it needs to be addressed as perfect the next day. And you may not be using this term perfectionism in even your thoughts and your logic, but it still is represented by your efforts. So striving for excellence is okay, but perfectionism can be hazardous to relationships and to your health, because again, mimicking a heart attack, if you get that anxious, isn't good for your heart over time. And I can go into, if you like, some of the events that actually happen when you have these thoughts, because your brain sends messengers down to your adrenal glands. There's two of them, little olive-sized organs above your kidneys, one on each side of your spine, and they have 4 zones in each one, and things like cortisol, adrenaline, DHEA, up to 1,400 highly toxic chemicals can be released into your abdominal cage when you're having an anxious thought or you're driven to some real fearful event. So up to 1,400 chemicals. Can you imagine what that's doing to your organs? It gets into your bloodstream. It goes into your brain. Makes you highly alert, of course, but that's part of why you feel this impulse to, have anxious outbursts. It's designed for the fight or flight syndrome, really. The ability for you to run or stay and duke it out. So your blood is pulled out of your hands and your feet and away from your digestive system, so that you're not going to get sick if you're trying to digest food in the middle of a fight or flight incident. So you have all these chemicals floating around inside of you, and if you do that, if you allow yourself to feel anxious frequently enough, you're going to make yourself sick over time, because it takes hours and hours to flush out all those chemicals from your body. And if you repeatedly get anxious during, say, a 24-hour event, then you're not flushing it out, you're just adding more to it. So some of the tools that I employ to help people who have a condition of anxiety is to evaluate if they have a history of trauma. Would be one of the early things that I would do. I would also make sure that there isn't an underlying medical condition that may be causing it. Say any number of things could be happening in the brain that could be sending the wrong messengers to the adrenal glands again, and then causing these anxious feelings. So once we eliminate that as the cause, then we look at a history of trauma. And I have a very effective tool known as EMDR, which can actually heal traumatic wounds from a lifetime of trauma. It could be that you've had one acute incident here or there, or it could be chronic. It could be small things, but that build up over time where it's lowered your self-esteem and prevented you from having normal, healthy relationships or achieving the most that you can achieve in your lifetime. And there's nothing worse than, coming to that place in your life where you're elderly and you have regrets about not having tried harder to reach some golden ring that you aspired to in your heart because maybe you were afraid. So anxiety can be very paralyzing. It can eliminate your ability to even go to a barbecue or go to a doctor for fear that the doctor's going to give you bad news. So anxiety can be very debilitating in that way. So we start with removing, if you will, the traumatic wounds that you've been carrying around. You may not even realize that it's there, but if somebody were to bring it up, you might have a little tearful moment, or it may make you sad. That's kind of an indicator that you haven't addressed some emotional incident in your life where you've been wounded and just buried it and just put it aside and thought, if I just get past it, buck up, soldier on, I'll do okay. But the facts are that you wind up making decisions around that wound to cover it up and pretend it's not there. That's part of the denial. So once we get rid of the wounding part of you, then trauma is no longer a reason. Then we start to look at psychoeducation, which means cognitive behavioral therapy. How are you languaging your issues? Are you playing the what if game? Are you saying something like, I should do this or he should do that? Which is a way of manipulating your reality to get more out of yourself, which triggers more anxious feelings. Again, because there's a cycle of anxiety that is triggered by stress. So you have a stressful event, say you get married, or you get divorced, or you move, or you have a baby, or you age and you start to develop a disease or some kind of illness. Those are very serious, stressful incidences, even though they can also provide a great deal of happiness. But the stress itself triggers anxiety. And then when you get anxious, you then cause more stress for yourself. And then when you cause more stress, guess what? Then you're causing more anxious feelings, and it becomes a cycle that repeats and repeats, and that cycle gets smaller and more active and happens more frequently, and to the point as you become a senior, then you're dealing with it on a daily basis without any real danger that you're facing, and not the real reason you have that instinct for self-preservation to begin with. And so I liken it to be like a faucet that's always on. And so we need to retrain your adrenal glands to start to close down and just relax. So we have relaxation techniques, meditation, and practicing of mindfulness is another one that I do a lot of work with my clients around, because you need to be mindful about what is it that triggers my anxiety, mindful about managing my outbursts, or mindful about exercising so I have more endorphins and I'm more relaxed and I feel good. And when I feel good, I'm less likely to be reactive or in denial or avoidant, and so forth. And in fact, the old days are pretty recent, but the doctors are now shifting from some old types of medications that, are pretty powerful to some less, narcotic effect type of medications. So our country's kind of going through a change right now in terms of what we use for medications. And so if we can keep somebody from getting on medications that are addictive in nature, that's ideal. That's really ideal. But sometimes we can't help it because it's gotten too far along, and it's the addiction, not only to the medication, but the addiction to the habit of how to react, the habit of how you think, the habit of how you interpret your reality, which is based on your belief system, is so ingrained that it's really hard to just knock it out with psychotherapy alone. But generally, psychotherapy, if you catch it early enough, is good enough. It's more than good enough to be able to help you, again, using some tools to eliminate those wounded traumas that you're carrying around. We've actually shown that trauma is stored in the frontal lobe of your brain. The MRI will show that it lights up in your frontal lobe. So we know that also there was Candace Pert did some work on Molecules of Emotion is the name of her book, where she discovered that people actually create molecules every time they have a feeling. So if you put that together with the fact that you have PTSD in your frontal lobe right here in your forehead, then what they are is molecules. And what we're trying to do is separate those molecules. It's very physical. Separate those molecules over and then process the story that created those traumatic feelings and process them properly, where it goes through your emotion regulation center, known as your amygdala. Help to reprocess them so that they're stored into your long-term memory, no different than if you had a stub toe. So, hi, I'm Pam Goodfriend, and I'm a psychotherapist in Denver and Boulder, Colorado. And I specialize in anxiety. I work with people anywhere from teens to the elderly. I do a lot of work with seniors because specializing in anxiety actually is a big problem, not only for people who are anxious when they're a senior citizen, but for their families and their caregivers. It's very difficult for family members, but even your neighbors, your caregivers, especially seniors who have caregivers. A caregiver comes into the home, wants to help cook, clean, bathe, and that someone who's elderly, and the elderly person now whose anxiety levels have escalated with time and their ability to manage it has deteriorated, that caregiver thinks, possibly there's something that they did, but it's not. It's not personal. It's just that the person who's aging can no longer, affect a change or discipline themselves enough to manage those triggers. And the triggers can be even putting something out of place, or not buying the right thing at the grocery store. Because again, it goes back to a certain fear that a person may have that they may not even be aware of, that they may not get their needs met, or a fear that, things aren't going to go right or well. And so again, that makes them anxious. So let's use financial. Let's say, for instance, you're getting to an age where your adult child is coming to help you with managing your checkbook and your finances, maybe your savings and investments. That can be very anxiety causing for a number of reasons. One, it represents a loss of independence, but it also represents, if even the slightest thing is imperfect in a checkbook, can cause that elderly person to feel anxious, not because they're wanting to blame their adult child for making an error, like if they fail to enter a number in the check register, or to whom a check was written, or for what purpose, but it's just a representation of not being perfect, because anxious people tend to set the bar really high around perfectionism, and unwittingly. And then that's very difficult for not only the anxious person, but for anybody in relationship to them, because perfectionism is a moving target and it's very subjective. So what's perfect in your standards may not be perfect in the next person's. And what's perfect for you one day may not seem like it needs to be addressed as perfect the next day. And you may not be using this term perfectionism in even your thoughts and your logic, but it still is represented by your efforts. So striving for excellence is okay, but perfectionism can be hazardous to relationships and to your health, because again, mimicking a heart attack, if you get that anxious, isn't good for your heart over time. So what we found is that as people age, they tend to worry more about their health, and that's a natural condition. However, people who are more prone to anxious feelings are more likely to what we call perseverate. They get so anxious that they want to go to the doctor for every little thing, even though sometimes those little things are indicative of a more serious condition. But an anxious person can't discern the difference between what is a real fire alarm and what is just the smell of smoke burning. Okay, so they tend to not be preventive in their health. They tend to turn it over to their doctor or the emergency room. And I've had, many clients where I've had to work with them on trying to practice some skills, because what happens is I get calls from ER doctors, social workers, and from doctors' offices saying, how can we partner with this particular patient because they're overusing medical services. I would recommend that they contact either their doctor or get online if they go on the internet and start to look up. There's lots of informational websites about anxiety, just to give you a preliminary insight into the problems. And then you can go onto other websites like Psychology Today and goodtherapy.org and websites like that, where you can find referrals for a psychotherapist in your area. It's very important to just go in and see, if maybe you do have a problem, and how somebody who specializes in this area can help you. And your insurance normally pays for it. If you find that you're the adult child of a senior who is starting to have health issues that stem from anxiety and anxious feelings, and you'll know this because you've grown up with them just like I did, then first of all, learning as much as you can about anxiety is really important, because it helps you have more empathy for them. It helps you to understand that reacting to them accomplishes nothing. However, your patience is obviously required. So what you can do so that you don't burn out from the anxious outbursts, the angry outbursts that are so unexpected and unwarranted, but yet your family member can't necessarily help themselves. So the idea would be to seek outside services to help your family member as much as possible, so that you don't burn out, so that you don't become impaired by being overly exposed to those behaviors. And get that family member into counseling and in to see a doctor. Sometimes medication is warranted, not always.